welcome everyone to our second episode of season 4 of Doc Talks with Forrest, Tennant, and Friends. We are so happy you could all be here with us tonight, and we look forward to a special night. We have a great special guest, Ms. Harris, and looking forward to this evening. Thank you so much, Dr. Tennant. It's all yours. Thank you.
Yeah, thank you, Jamie. And Dr. Ibsen and I welcome the opportunity to be with you again this evening. We know we have a guest with a rare disease and a terrible pain problem, and I think we'll find a lot of interesting things from her. What I want to do tonight, and this is our second session here in this run of videos, I want to talk about a research effort that I'm doing and I'm very perplexed about and very concerned about, and I'm looking for some answers. About 7 years ago, now we established the research and education project on arachnoiditis. At that time, we knew there was something called adhesive arachnoiditis, which was the major problem that we were looking after. And that's primarily a disease of the lumbar sacral spine. There is something called non-adhesive arachnoiditis. And we think this may be a major, major problem as it involves the cervical neck. Now, what we're going to talk about tonight is what I know and where we are at in looking at what I call one of the two worst pain problems, unaddressed problems, if you will, in the nation. And that is cervical neck pain. And we've already addressed the other one, and that is pudendal neuropathies. These two conditions have been totally recalcitrant, totally resistant, almost to any pain relief. And as a matter of fact, if you go to medical meetings, you talk to other doctors, you talk to anybody, nobody wants to talk about the terrible problems of neck pain or pudendal neuropathy pain. And I want to start off right now by telling you how I got into this very simply. My clinic was referred a number of people with neck pain. They'd had surgeries, fusions, been diagnosed, brachial neuropathy, thoracic outlets, all kind of neck diagnoses. And most of it had surgeries and one thing or another. And they were referred because they had failed every pain treatment you can imagine, including high-dose opioids. And I want to start off by telling you the thing that got me so interested in neck pain is that, quite frankly, we prescribed 2 and 3 potent opioids to some people with neck pains and got almost no pain relief. Just didn't seem to work. Couldn't find anything that worked. Topical medications didn't work. Injections didn't work. Epidurals didn't work. Surgery didn't work. In other words, I want to bring this out because I'm well aware of cases right now in which neck pain just could not be resolved. And I guess that is no secret. Anytime you have somebody decide to take their own life because of a pain problem, it sticks in your mind. And I've recently had a patient I've tried to help for years, finally went to Switzerland to take his own life because he had tried everything imaginable, including the highest dosages of opioids. I'm talking about 3,000 and 4,000 milligram equivalents a day with fentanyl patches, injectable dilaudid, the works. In other words, there was no restriction of pain medications. It just didn't work. So why? Well, I want to tell you right now, I'm not certain. Okay, that's why I'm bringing it up tonight. I'm bringing this up for one reason. If anybody out there watching this has any ideas, any novel thoughts, any new treatments to help people with certain neck pain, let's hear it. Because let's be honest about it. We doctors don't know what to do about this. Okay? There are patients that we just don't know. Just nothing seems to work. Now I'm going to try to take you through some steps as to what I do know about it and what we have been researching. Okay, and I'm going to show you an MRI and give you some thoughts about where I think we are at. Now, first off, I do want to tell you that these people who have had this recalcitrant neck pain have a standard looking MRI. Now, one of the advances has been is that we've at least been able to see what's in that neck. And I'm going to, perhaps I'm going to show you a diagram in a little bit, but I just wanted to show you here real quickly an MRI, and I doubt if you can see it too well, but what you have here is the vertebra, the spinal canal, and the white there is either the canal cover or spinal fluid. Now, in a few minutes, I'm going to show you a big diagram and what we're looking at here.
Okay.
What I want you to know for right now, however, is that these people who have had this terrible neck problem show multiple discs, not just one, but they show multiple discs that have degenerated and are pressing upon the spinal canal. Okay, now tonight we're going to take this copper pipe as our spinal canal. Okay, and it's got a hollow center, so we're going to refer to this in a couple of minutes so I can at least tell everybody where we're at and what we know and maybe some directions that our research is trying to go. Okay, now to get us started, we're going to take a basic anatomy lesson here for real quick, real simple. The brain and the spinal canal really consists of three layers. One really doesn't count, it's the pia mater, but really two layers. The outside, now here's this pipe here now, okay? The outside tough layer is called the dura. Inside layer is the arachnoid, and it goes either by an arachnoid lining, arachnoid layer, or it's traditionally been called the arachnoid membrane. Now, it's called arachnoid because in the 1600s, I think the Dutch, after the microscope was invented, could see that it kind of looked like a spider web. And it is. It's very thin. It looks thread-like. It looks just like a spider web. And it does have a blood supply, but it also has a lot of very fine nerves just loaded with collagen. And it's very painful if you tamper with it, as a lot of you know. So what you have here is a spinal column that's hollow like a pipe. Now this little pipe's about a ½ inch across, and the spinal canal is about a third of this. So it's a small pipe, but nevertheless, it's got an outer layer called the dura and an inner layer called the arachnoid. Now in 1873, they actually defined arachnoiditis in medical dictionaries. 1873. And guess what? The definition hadn't changed. Now, the definition of arachnoiditis in 1873 was simply inflammation of the arachnoid membrane. Okay? So if you find a medical dictionary that dates clear back to 1873, you'll see under arachnoiditis, inflammation of the arachnoid membrane. Now, what's interesting for you to know, and here's our kicker. How did they know that in 1873? They figured it out from autopsies. Okay. One of our problems today, you can't go around biopsying the arachnoid. Okay, we can't take it out, otherwise you'd be crippled. So you can't take out the arachnoid liner, or you can't biopsy it. You can't tamper with it. Okay, so consequently, when it's adhesive arachnoiditis, now in the lumbar sacral spine, these are the cauda equina nerves clump up or go into a little mass or group, and we can see it. We cannot see plain arachnoiditis on the MRI. Okay? In other words, we don't have a specific test for it. We sort of do what doctors call a diagnosis by exclusion. We exclude everything else that may be causing the pain, and we make that diagnosis of cervical arachnoiditis when we don't have any other cause of this. But the MRI is indirectly suggestive of arachnoiditis of the cervical neck. And I want to tell you here right now, it is my opinion, and I hope a whole lot of people challenge me. I hope a whole lot of people disagree with me because I'm floundering about this, okay? It is my opinion that people out there who are not getting the relief of their neck pain is due to plain arachnoiditis of the arachnoid membrane in the neck, okay? And they can't see it on an MRI, and so no one wants to diagnose it. I'm diagnosing it on a research basis as a hope to try to have a direction to do something for these poor folks. And I know some of you out there are shaking your head saying, oh yeah, you know what I'm talking about. Okay. Now, let's go a little further, if I might. First off, how do people come to doctors' attention with this neck pain? Well, a lot of times early on, they'll come to a doctor and they've got numbness or in their hands. Maybe they've got a feeling in their hands or their arms, maybe a weak wrist, and the doctor will then take an MRI and find the disc has slipped or something has gone wrong in the neck, and that's fine, and we can take care of a lot of that. And a lot of people who end up with this condition start off with a condition of brachial plexus neuropathy or thoracic outlet syndrome. And that's sometimes kind of a wastebasket diagnosis because the doctors don't know what else to call it. Okay. But I do want to tell you that what we have learned in the research is something about this MRI picture. Now, here is what I want to get across to people. Here is my drawing. Okay. And this is not a very good looking head, but you can see an ear, nose, and mouth. What we have here are discs. Okay, I've listed 4 of them. And there's a disc in between each one. Okay. Now, discs are soft tissue, they're collagen, and they can become inflamed by a lot of different, or 1 or 2 different mechanisms, which I'll explain in just a minute. But what we see in these people with this terrible neck pain is that not just 1, but 3 or 4 discs are pressing on the spinal canal. Okay, they've degenerated and they're pushing on the spinal canal. Okay, they're pushing on the pipe. Now, what are they pushing on? They're pushing on the dura and the arachnoid layers. And on the MRI, you can see where it has almost disappeared because the disc is pressing so much. Now, if the disc presses in far enough, the surgeons like to call that stenosis, but if it doesn't get too far in, they just don't know what to call it. They don't call it at all. They just say the disc is pressing on the spinal canal. But here is what I want everyone to know. You don't just go walking around planet Earth with 2 or 3 or 4 cervical discs that are degenerating and pressing on the canal without having some serious degenerative disease causing degeneration of the discs. You just don't get that because you got hit playing football one time or fell off a ladder. That you might get 1 disc or maybe 2. But when you start getting 3 and 4 discs that are degenerating, that's a metabolic disorder, and we now think that's an autoimmune disorder. Okay, so that's what it looks like. Now let me go on and talk about where we're at with our research. I started off getting interested in neck problems because we couldn't get the pain relief. But then later on, what's been interesting, I've got a huge number of people who started off with lumbar sacral adhesive arachnoiditis. And then later on, they say, doctor, I now think I've got arachnoiditis in the neck. Well, they probably do. But it didn't spread like a cancer The same disease that caused the degeneration of the disc in the lumbar area is causing it in the neck area. Okay? Now, what do we think that is? Okay, first off, those people who have a hereditary collagen disorder like Ehlers-Danlos, or what we now call a hypermobile spectrum disorder, are very susceptible to cervical neck degeneration. Okay. And what we also are now finding is that all these people do seem to have a parasitic autoimmunity. And of course, the major parasitic virus that causes autoimmunity and degeneration of these discs is the Epstein-Barr virus. And so we think that this autoimmunity is coming from the lymphocytes, coming from the thymus gland, the spleen. It's coming from the immune system, causing the degeneration of the discs. The discs are pushing onto the spinal canal, and surgery and other medical means hasn't helped. And terrible pain does now exist. That's where we are at today. Okay? In other words, I don't have a specific treatment. We're recommending the three-component medical protocol for cervical neck disease, just like lumbar sacral disease, and we're assuming that we have non-adhesive arachnoiditis in the cervical neck, and it is primarily being generated by an autoimmune disorder, probably the Epstein-Barr virus. Now, let me just say one other thing about the Epstein-Barr virus, because you're going to hear a lot about it. The Epstein-Barr virus is a herpes virus. It's a herpes number 4. Now, they call it Epstein-Barr virus because they're named after the two laboratorians who discovered the virus, but it's one of the herpes classes, along with herpes 1, 2, and 3, and cytomegalic virus. And those viruses, oftentimes, we're now finding out are in the same person. And under stressful conditions like accidents, severe infections, trauma, those viruses reactivate and cause an autoimmunity that we then now believe is generating inflammation in both the lumbar cervical spine and also in the neck. That's where we're at. So bottom line is, this is where we're at. We think that this terrible pain is partially caused by non-adhesive arachnoiditis. We think that discs have degenerated due to an autoimmune disorder, probably caused by viruses that have reactivated. We think that people who have hereditary collagen diseases or who have had trauma or perhaps are more susceptible to this. And so that is where we're at. And I'll just close this session out by saying this. If anybody out there listens to this and has found a topical, an injection, a physician, a procedure, a medicine, anything that you think has helped your severe neck pain, let us know about it, would you? We're grappling, okay? We've been through the high-dose opioids. That's not been what we're talking about here. We're talking about trying to find something else that works. And let me close with this statement. Why don't the opioids work real well in these cervical neck problems? We don't know. We don't know whether the blood supply is really poor in the neck. We don't know whether you've had a destruction of the arachnoid membrane or the small nerve, just like in pudendal neuropathy. We just really don't understand why we can't get, why you can't take your oxycodone or your hydrocodone and your Valium and your gabapentin or your Ritalin and get some good pain relief in the neck. But it doesn't happen very oftentimes. So therefore, we're grappling. But I wanted to bring it up, get it out here on the table. I think one of the worst things in medicine today, and I'll be honest about it, is this saying to work, when you don't know what to do, let's not talk about it. Hey, we've got the internet, we've got social groups, we've got great communication on this planet today. If somebody in Australia listening to this thing has an idea, God, send it to us. If it's a new herb, we don't care. Whatever it is, send it in. We're looking for help. Okay. With that, and again, any communications on these two problems what we've talked about, pudendal neuropathy, cervical neck pain, uh, we invite you to educate us. Okay. Let's go on and bring our guest on. Jamie?
All right.
Wait, wait.
Perfect. We have Miss Harris with us tonight. And welcome,
Hello.
Miss Harris. Welcome to Doc Talks. Great to see you.
Thank you. Thank you.
And I guess you're going by Miss Harris, right? We can
Yes,
call you
sir.
that? Okay,
Yes,
we'll call
sir.
well, we're gonna call you something, so we'll call you Miss Harris. How's that sound?
Thank you very
Uh,
much.
the I know a little bit about your history. First off, uh, you look pretty young. Tell us how old you are.
I am 42.
Well, that's pretty young. Okay. When now you've had this rare disease, I want you to tell the audience how you got this strange diagnosis that only happens once or twice in a million people and how it happened. Tell us how you got started with your journey.
Okay, so when I was 15, I was in a cheerleading parade with my fellow cheerleaders, and we cheered and walked for like 2 hours cheering. And afterwards, my arms hurt so bad, like they did normally, but I had a weird feeling I should ask the other girls if their arms hurt really bad. And so I asked one girl after another, and every girl said no. And that is the day that I realized that I had something going on that was not normal. Because up until then, I thought that everyone's arms hurt that bad when they did things with their arms.
Okay. And so your arm, did it tighten up or you couldn't move it or it just hurt?
My arms feel like they weigh 50 to 100 pounds each. And it's all coming mostly from my shoulders, but I have a lot of elbow. It's all of it, and my neck as well. So yeah, so my arms just hurt so bad. Like they felt like I had been lifting weights, not pom-poms.
Did the pain go away after a while? After that first episode?
I mean, probably an hour after after cheerleading for that parade, about an hour, it subsided some. But that's the day that I realized like that wasn't normal. And so I started searching for answers. So I started off with a, neurologist, and then I started seeing surgeons after surgeons after surgeons. And I did actually get rotator cuff surgery in 2008, and that did help. But I knew in my heart and my soul after that surgery, when I was doing my physical therapy, that there was something else much more going on. And so, go ahead, sorry.
Go ahead. No. So you were 16 when you had your first episode of arm pain. So go ahead and tell us what happened in your 20s and when you got your rare diagnosis.
So it actually took 21 years to get this diagnosis, to get my diagnosis. What finally happened is my suprascapular nerve was crushed for so many years that my muscles were atrophied 100% in my right arm and about 85% in my left. And you could see that clear as day in the MRIs, but it's so rare that even all the MRI readers and all the surgeons I saw, missed it. So it took 21 years to get diagnosed. And then I spent another 5 years seeing 17 top surgeons, including all three Mayo Clinic, the one in Florida, and then they consulted with all of the rest of the Mayo clinics. The Miami Marlins team physician, the Tampa Bay Rays, the #1 surgeon on the Forbes list. None of them had ever seen my condition in person. They had only learned about it in medical books. So I finally found 2 surgeons, the one that pioneered the muscle transplant and the second person in the world to do a nerve transplant at Boston Mass General Hospital at the Paralysis Center. And so they finally, had never seen it they never had seen anybody have it in both arms, only one suprascapular nerve, not both, not on both shoulders. And actually, I have more than 30 crushed, not pinched, but crushed nerves and muscles all throughout my shoulders, neck, arms. And that's just my upper body. And now that I know what they are and how they feel, I know they're throughout my whole entire body. And I did get 10 biopsies done in my shoulders and arms, and I do not have small fiber neuropathy. So, yeah.
And so when were you given your diagnosis, and what was it?
It was, so it took 21 years. So it started at 15. So 21 years after 15 is what, 36? Is that right? So it was called suprascapular nerve impingement, not due to a cyst, with severe to total muscle atrophy. That was my first diagnosis. But then after I went to the paralysis center, because I do have paralysis, not every time after I sleep, but many mornings after sleeping for the first, it could last up to 12 hours that I can't lift my arms. And then I have, flare-ups where I go months where I can't lift my arms.
Now, and were you given the diagnosis of stiff person syndrome?
I do have that as well. And I also have reflex sympathetic dystrophy in both arms, and it recently spread after I had surgery at the paralysis center. I had 4 nerves and 1 muscle uncrushed surgically. And the whole idea was to get all 30 uncrushed surgically, and they can only do about 5 at a time. And then I would get muscle and nerve transplants. It's a very long process, but that was like a 10-year plan, because once you get a muscle transplant or a nerve transplant, it takes 12 to 18 months to even know if the surgery was successful, and then 3 years before your nerves and muscles start to repair and grow back after a muscle or nerve transplant.
Now, can you tell us what have your doctors told you caused these muscles and nerves to be crushed?
They have no idea. They have absolutely no idea. And I kind of skipped ahead, and because I was just explaining that one diagnosis, but like in 2018, I lost my care. And that's when my reflex sympathetic dystrophy spread from my arms, spread from one arm, to my other arm. And it was so bad. And I spent a year in bed. I then came down with stiff person syndrome. Up until that time, I also only had like 1 bulged disc. And then the last MRIs that I've gotten for the last 4 years, I have 15 herniated and bulged discs in my neck and back. And we don't know how they came about as well. And my neck feels like it's broken. So what you were talking about earlier is like exactly what I'm going through. And I'm quite sure that I probably have adhesive arachnoiditis in my neck and back probably.
Tell us about your pain now. Have you been able to get pain treatment along the way, or have you been
So
cast out like a lot of people? Tell us about your pain treatment.
So the first 11 years from age 15 to 26, 15 pills would last me 6 months to a year and a half. So I got them, whenever I needed them, but they lasted me so long. And then it got to a point because I was a master hairstylist and a maid. So my job was a lot of repetitive motion. And I did have to start taking pain medication daily at the age of 26. And I had pretty good care, although I never got an increase in my meds up until 2018. And I lost my care and I spent a year in bed. And that's when my reflex sympathetic dystrophy spread. That's when I got stiff person syndrome. That's when my health really started to decline. And then I found care again after a year. And then right before, the day before I was flying out to the paralysis center to get surgery, that it took me 26 years, 21 years to get diagnosed, and then another 5 to find a surgeon to try to help me. So it took me 26 years to get this first surgery, which was on the suprascapular nerve and 3 other nerves and 1 muscle that he was uncrushing. And my doctor cut everybody's medicines in his office, and mine was cut in half the day before I was flying out to go get my surgery. So my health was really bad the last since December of 2022.
You said you lost your care. What can you be specific? What care did you lose?
Pain medication. Right before my surgery, my long acting was cut in half and my short acting. And so that surgery went terribly. And I spent the last 16 months just in bed. And then I was put on hospice. And I was on hospice for the last 3 months. And I don't know if people know this, but there are people that are on hospice that cannot feed themselves. They can't dress themselves. They can't bathe themselves. They can't go to the bathroom themselves. And even them, if they're not declining, like if their arm is not shrinking in size, because they measure your arm, they will take you off of hospice. So, yeah.
So what are you supposed to do if they take you off hospice?
They referred me to a nurse practitioner, which I already have one. But in the state that I'm in, there's only 2 states where a nurse practitioner cannot prescribe medications. Even under the supervision of a doctor, they cannot prescribe medication. I told them that, and I have my nurse practitioner that I've had for a while that comes to my house, and they are trying to refer me to palliative care. But this just all happened like on Fridays when I got discharged. So, that was only a little less than a week ago. So it's a lot's been happening just recently.
Yeah. Dr. Gibson, would you chime in here at this point? I've got some other questions, but knowing you, you're going to have some things to say about this, question-wise or comments. Mark, chime in here. Help me out, would you?
Yeah, wow. What state are you in, Ms. Harris?
Florida.
Okay.
Yeah.
A nightmare for pain medicine there.
Oh,
And then, so are you, what has chiropractic, or osteopathic or manipulative medicine or acupuncture done? Have those been useless to you?
I've tried every single thing you could possibly imagine, except for I did not do stem cells. I actually had it scheduled. But my husband recently, well, 2 years ago, he passed away on my 16-year anniversary. And so he went into the hospital the day before I was going to get my stem cells. And afterwards, when I was talking to one of my local surgeons, he said, I do stem cells. He said, I'm glad you didn't waste your money because it would not have helped you.
Yeah.
But I've tried everything. My favorite thing, and actually Dr. Tennant did ask what does help, and it's lidocaine patches. I think chiropractor definitely helps. And I've been searching for a waterfall, water therapy for sure helps. And I think that there is something to that electrical charge that Dr. Tennant was talking about, and how magnets and, water can kind of make that kind of, neutralize that, if you will.
When you went to the surgeon and he uncrushed your nerves, what does that mean? And what actually was crushing the nerves?
They do not know what's crushing my nerves. They have no idea. But
how do they know that they've uncrushed it then? I mean, it might be curious. It might be curious to see what the operative report says. Like, is the scapula pressing on the nerve? Is the teres major pressing on the nerve? Did they distinguish exactly the anatomical thing that's happening to your nerve?
Well, and like after I got diagnosed and I saw the 17 top surgeons, these are the two that I felt comfortable with, that knew what they were talking about. You know what I mean?
Yeah.
And but my suprascapular is definitely the worst because it's been crushed for so long. My muscles are completely atrophied in my right side, and they are 85% last checked in my left side. Now, I don't want to forget this, and I do think I should bring it up. I do have a pituitary brain tumor. This is my second pituitary brain tumor. When I lost my care in 2018, I lost my my period. Sorry. And I got it back when I got my medicine back in 2019. And then I lost it again. I mean, I lost it the very month that I lost my care. And now I haven't got my period. I thought when I got on hospice and got my medicine restored, I would get my period back. I was hopeful, and it did not come back. But I think that having this pituitary brain tumor that affects all your hormones, I think that plays a really big part in why, medicine sometimes works or doesn't work sometimes, and that kind of thing. Plus, I have the P450, PY450. I took 2 genetics testing, and I am a rapid metabolizer, and I'm an intermittent metabolizer as well. So that's why sometimes pain medication works okay, pretty well, and then sometimes it doesn't seem to work at all. So I think all that factors in, and no doctors will take either of those 2 things, being that genetic, the gene that I have, the genetics testing that I did twice, or the pituitary tumor. They're not taking those into account of for anything. It's like, it's nothing.
How have you stayed alive?
Honestly, God, I have a really close relationship with God. I want to say this also too, is I had moments when I was under hospice recently where I felt adequate pain care. I actually went to church 3 times. I volunteered at my church for the homeless people twice. I can't do much because I'm going paralyzed in my arms, so I can't do much. But I went to the beach twice. I took my dog once, and then I went myself. And it was the best, best few things that I've gotten to do in such a long time, because I've been in bed for so long. But shows like your show, y'all's show, has kept me alive, and my relationship with God.
Thank you.
Yeah. Ms. Harris, I salute you for what you've just said. And but let me go back. I want to ask some other questions. You've mentioned here all along, you've seen all of these surgeons. Now, if you were given the diagnosis of stiff person syndrome, that's known as a autoimmune disease. It has its own autoantibody. Were you
Right.
tested for these things?
Yes, I was, but because hospice didn't seem to, they looked for a neurologist that diagnosed me, and they didn't ask me. And my pain doctor actually is the one that diagnosed me and sent my labs out. I don't know why they didn't ask me. And I have a picture today of SPS doctors in Florida. There's not one within 3 hours of me. So I don't know why they didn't ask for those records, from me, and or where they were, which doctor they were, so that they could get them, but they didn't. But that's a relatively new diagnosis, the stiff person syndrome. I got diagnosed, my first episode basically was on Valentine's Day of 2019. And so I got diagnosed in April of 2019. So that's fairly recent. But when I went to go see surgeons about my arms, they didn't even bring up the stiff person syndrome. I mean, because I'm seeing, the head of the paralysis center and the head of the orthopedic department, surgeon department of, so my arms have always been such at the forefront that everything else got pushed back on the back burner. Everything.
Next question. How tall are you?
5'2".
You're short. Okay. Now, you started off when you were 16 years of age. Now, I realize when you were 16, this was not done. Now, a 16-year-old today who has arm pain or any kind of pain has to be evaluated or should be evaluated for one of the Ehlers-Danlos syndromes, or what we call, hypermobile spectrum
Right.
disorder. Now,
Right.
did anybody ever use those terms with you?
No, I've never gotten, because they were always just looking at my arm. And I was I was pretty proud in that I would kind of downplay everything and hide everything, even from doctors. And I still find myself doing that. But I was raised in the South, and you say, yes, sir, no, sir, and you don't question anybody, and you don't show like your emotions and that much. And, even to doctors, like I would find myself hiding my pain and hiding problems, and I was so concentrated on my arm trying to figure out, because it started with just like one arm being really bad, my dominant arm, and then it was both. But I was so concentrating on that it was like the whole appointments were all talking about that. It wasn't, we didn't go into other things, but I have a high suspicion that I have EDS. And like I said, I have a high suspicion that I have adhesive arachnoiditis in my neck and in my back, because why else would I, for no reason at all, have only one bulged disc forever, and then now I have 15 herniated and bulged discs, like out of nowhere.
Now let me ask you, you've talked a lot about all the doctors you've seen. Now, did a rheumatologist at any time take autoimmune tests from you, or an internist take viral tests, interleukins, hormones? Tell me about laboratory testing in your case. I mean, you've gone through this for years with what sounds to me like an obvious hereditary autoimmune collagen deficiency disease.
Yeah.
And it sounds like you fall into what today, and I will give the Ehlers-Danlos Society a plug here. The fact that they are using that term hypermobile spectrum disorder is where you obviously fit, because you've been given all these different diagnoses, but those all get thrown into what one umbrella today, which is a good thing, because you should have been, frankly, nobody knew, and I wouldn't have either, so I'm not being critical, but today you fall in that category. And just because you started these pains in your arms, I mean, okay, so you started in your big toe. I mean, you got to start somewhere if you have collagen disorder, and then when you got your CYP 450. But again, now the autoimmune antibody for stiff person syndrome is called a GAD65. Did you ever have that? Is it positive?
Yes, but I do not know the number. I apologize. I looked for it and I don't know the actual number that I got back on that test.
Uh-huh.
But I would like to get tested again so that I could, just to see where it's at now.
Yeah. Now, do you carry a 3-ring binder of all your records and everything?
Oh, I'm very organized with my medical records and everything. The only thing is that, and to go back for 1 second, I've mostly seen surgeons. Like when my neurologist retired, the one that I started seeing when I was 15, I tried to go to another neurologist and I was with him for a little while. But then after I went to Mayo Clinic, it was like 2018, and same with a rheumatologist. They didn't even seem to want me as a patient. Like 2 doctors actually said to me, you went to the Mayo Clinic. What do you expect me to do? I can't do more than them. When I walked in the door, and I was a previous patient of theirs, I think that the doctors were just so scared. They didn't even want to have a patient that was on medication, even though I never asked them for medication or anything. So I really got kind of scared, and I mostly saw surgeons. And in my whole life, I've seen mostly surgeons. When my doctors retired, I just didn't try to find any more. And then as far as my medical records, I have 3 suitcases of medical records. My psychiatrist's office helped me to get them organized for right before I got put on hospice. We spent 14 months getting my medical records very organized. The reason why I don't have the medical records from my pain management doctor is because if you can't ask for them, until you have another doctor, and they can charge in the state of Florida, it's like $2 per page. It would have been like thousands and thousands of dollars to get those records. A doctor can get them, but I've never had very good luck with the doctors getting them. So I don't have those, but all my other records I do have copies of.
Uh, I'm going to have a question that I want to ask you here, and then I want Dr. Ibsen to kind of, you and he discuss where do you go now? What the one of the reasons I wanted you on the show is because you're a good example of somebody who's went years without a diagnosis. Now today, we've got all kind of profiles on genetic diseases. We can tell you whether you've got Ehlers-Danlos, whether you've got Marfan's. We can tell you whether you've got autoimmunity, which one it is. We can tell you whether your hormones, your pituitary tumor is probably the pituitary trying to overwork because you've got too much pain. That's another diagnosis being given all over the place, pituitary tumors, and that's just a pituitary overworking because there's too much pain out there. And so we've got the tools to diagnose people today, which you didn't have when you got started. And so would you have any, you went all these years, you were in bed, I don't know how you survived either, but what's your advice to people out there right now, because there's people watching this show who can't get a diagnosis, who have strange symptoms like you had. What's your advice to them at this time?
I actually do have a diagnosis. The problem is right before I got put under for surgery, my surgeon said that there is no known documented case of anyone having your condition in both shoulders, never mind both elbows and both arms, bilateral. So for the last quite some time, they have to just, there's not even a code for my diagnosis. So every doctor just has to pick a, neuropathy, they just have to pick some sort of code for billing because there is no known person with this. But it's crushed nerves and muscles all throughout my body. And so much so that it's atrophied my nerves. That's what my diagnosis is. Like I said, it took 21 years to get diagnosed, and I didn't give up. I would kind of wear a surgeon out and then kind of be, go, I don't know, sometimes months to a year, few years, and then go to another surgeon and go to another one and then go to another one. And it's been a long, hard road, but I didn't give up. I just kept going.
Mark, I'll let you close this out. What would you like to ask the young lady? And close this out if you would.
Well, thank you for telling your story. And I don't have any. Okay, let me. So you got a diagnosis, but you don't have a therapy. Sometimes my idea is to go to a therapy, whether you have a diagnosis or not, because to talk to someone who says there is no one with your diagnosis, and you're sitting across from the doctor, and I said, well, can't you be the first one to make this diagnosis? I mean, you can't be telling me I don't have what I have just because no one else has ever had it. So what you've got is chronic pain and dysfunction of your nerves, whether they're crushed or whatever the mechanism of it. You've got poor function that responds fairly well to intensive pain management at the dose that works for you. And the only other thing I would do is if I was providing your care is I would treat you for pain management and then adopt the tenant protocol and all of that, and then document how much improved you are and how you're not in bed any longer with the medications that we're giving you. So it was like, so someone says, well, you can't have what you can have, but you have it. So the reality is, and your case actually documents that with appropriate pain management and the other adjuncts such as chiropractic, et cetera, you can actually get out of bed and function.
Yes.
So
I
have
have that
proof.
documented. Yeah, I actually have that documented because I wrote a medical journal of my whole entire it's like my life story, but only the medical side.
Yeah.
And it takes 36 minutes to read. But I have it very well organized. I started writing it in 2018. It is, if you will, my book. And I finished it right before I got put on hospice. And it is my story. And any doctor, it's very well organized. It's, and so if any doctor that I have, I actually have that in my medical records for them to read, because if they read it, they will understand everything that's going on with my situation in my case.
Wow.
Another thing
Good
is
for you.
I would like to go back to the paralysis center and ask them to give me a more, like if they want, name the diagnosis after me, if there is no known documented case of anyone else having this, then why not they name it? I mean, they don't have to name it after me, but
No.
let's get like a actual, name for it. And you would think because it's so rare that doctors would be knocking at your door. That's what people think. No, it's not like that at all. Not at all.
No.
So, yeah.
Well, thank you so much for being here. And Jamie, thank you again. Mark, thanks so much. I want to close out with a statement here. Last week, I told a woman, when you supposedly have all these discs that are generated, why did they generate? This week, I'm going to say we've had a person here who's been told she has crushed nerves. I didn't hear that there was any trauma. And if you have crushed nerves, you've got a slip disc, you've got a nerve that doesn't function, you've had pain that show up somewhere, patients have a responsibility, and so do the doctors. Why do you have it? What caused this? The health system, in my opinion, has taught patients to be too passive. You need to ask, why do I have this? What caused this crushed nerve, this slip disc, this pain in my head? Why do I have these? All right, we'll sign off on this. And Jamie, again, thanks for sponsoring a great show. Mark, thanks so much. And Ms. Harris, you've been very delightful to interview, and I know you'll help a lot of people with some of the things you've said.
Thank
Again,
you.
thanks so much. We'll sign off now. Good night. We'll see you next
I'll
week.
stay on.
Doc, okay, and Dr. Tennant, before you go, this is something that Rob has asked. He has 10 disc herniations, and he's fused cervical spine. He's got a full lumbar fusion, and his physician has told him that that's normal wear and tear. So he did ask why he was having all these herniations, and they just said it's normal wear and tear. So he wanted to know what he should be asking her to look for at this point.
He should be asking for a bus on out of town to find a new doctor. Okay, I'll sign off.
Okay. Thank you, Doc. Thank you.
Can I say one more? One more thing?
Please do.
I will say that I'm telling you, my lidocaine patches, they are life-saving for me. I mean, life-saving. I could not live without them, and they don't work right away. It's days of 12 hours on, 12 hours off.
Okay, awesome. I understand. And thank you. And Dr. Clement, you had your hand raised. I'd like to hear.
Well, what I find disturbing about this whole thing is, one, is the treatment of medical records as if it was some sort of legal transcript, and the inability of some, particularly when it deals specifically with pain. All of a sudden now we have that's a legal issue rather than a medical issue. To me, that's just plain just troubling. The other thing that I wanted to ask you, did at any point anybody look at you and mention the word ALS or some form of ALS?
No, I forgot to say this though, but my mom had multiple sclerosis. But no.
Just
Okay.
Like I said, like my arms have been such at the forefront, my shoulders, I should say, that I mostly saw surgeons, and it was like everything else was just ABC letters to everyone else. I don't even think the surgeons know what reflex sympathetic. I mean, a lot of them, I don't know that they even know. They might now, but they didn't even know what RSD was, or stiff person syndrome, or, you know, yeah.
Can I ask Dr. Ibsen a question?
Yes, please.
Oh, Dr. Ibsen, is this um, where to go? What's happening here is it has to do with the training or the lack of training or the or of proper training of physicians who are studying neurology, or is there something else? I mean, in terms of you have physicians that say, "Well, I don't know what this is. You know, let's go down to let's try this or whatever." What?
That's a brilliant
What's
question,
that?
Norm.
What's happening here?
I believe that the training that doctors are getting nowadays is
Uh-huh.
stay away from anything challenging that may make you as a physician an outlier.
So in other
And
words,
then it's fear which is dominating the
it's a medical
situation.
legal issue that's driving this
Well,
whole
it might be
concept right
medical
here.
legal it might be medical legal from the standpoint of lawsuits or malpractice, but what
Right.
I'm seeing, it's a regulatory issue in that doctors don't want to stand out with anybody else in their medical board. They don't want to be treating an unusual patient. They think that maybe you're nuts because we blame the patient when we can't diagnose them. In what other industry do we do that? Do we
Well,
do?
well,
It's
no.
like that's
Well,
the training.
here's the argument we have brought up, and you're within the norms, okay? And that the word outlier. I mean, the
Yeah.
outlier doesn't tell you anything about
No.
the outlier only says, to me, it says that maybe Dr. Ibsen is knowledgeable enough and good enough that he knows how to treat these conditions rather than take they call a person an outlier. And then criminalize them for being for treating and being good at treating and getting results at treating certain patients with diseases and stuff.
Yeah.
Yep. That's it.
Perfect.
Yeah.
Perfect.
Well said, Norm.
Thank you.
And we see, and one more, okay, we see this in this concept that the DEA uses in that money balling. Ann Milgram refers to outliers. This sort of the data analytics and this whole outlier concept is driven by fraudulent or defective data analytics, which then changes the behavior in the physician to address the patient issue, because they said, well, I don't want to hit home runs. I mean, if you want to take it to the basic, Michael Jordan was an outlier because he was good at what LeBron James is an outlier.
Mhm.
You know.
Yes.
Nice.
All right.
Perfect.
So
All right.
Can I
Thanks,
say
everybody.
one more?
And
Yeah.
we had one hand up. We had Kristen that had something to say. If we could add something in the next.
And Ms.
4
Ms.
minutes.
Harris has one more final thing to say also.
Oh, okay, good,
Um,
good. Yes, please.
I will say this. I've only had, including my pediatrician, I've only had 4 doctors treat my pain. I had my pediatrician who retired, then my first doctor that I had for 10 years who died, my second one that retired and gave his practice to the third one, or you could say fourth if you include my pediatrician. But with all those surgeons and all those doctors that I've seen and everything, I've only had one doctor, and I've read the records. So I see what they say, to my face and the records. I've only had one doctor in my whole entire life that basically wrote like that he didn't think I had anything wrong or needed any more additional testing. So I've been believed by every doctor and treated pretty respectfully by
Good.
everybody. So I will,
Yeah.
and I haven't had that many doctors treating my pain, but with all the surgeons and everyone, I've never had anyone like not believe me. So I think I
Thank
got
God.
lucky with that. Yeah.
Yeah, thank God.
Sorry, I don't know.
To answer your question, Lori, why she wasn't on hospice or was only on hospice for 3 months is because she wasn't declining quickly enough. Maybe you two could connect because you have very, very similar stories. But we did have Miss Kristen. Kristen, are you still with us?
Yes, I am. And I'll just say something very quickly. The whole discussion about records is one that's very concerning to me. Some of you may recall that my name was among the advocates who worked to try to influence the final version of the California prescribing guidelines that were issued a while back, and along with Monty Goddard and quite a few other people. And one thing that I noticed in the first rough draft we were given to look at, and in other places, there's statements that you should not accept records from patients because they may not be reliable. I have collected Louis Ogden's records since the early 1990s, and a lot of the pertinent things that got tested for and eliminated, those things occurred a long time ago. So the last 5-year snapshot does not tell you everything about him.
Exactly.
And I think a lot of it has to do with liability. They'd rather not even know about what the old records say, and they certainly are not going to want to take them from the patient. And I think that's very, very unfortunate. Records are something I value very highly. They're important, and the ones that we have are legitimate and real, and we collected them all these years.
Yes.
That's it.
And may I say one more thing about medical records?
Yes, please.
I agree, they're not reliable. You know what's reliable? A history and a physical.
That's right.
You can't fake the history and physical. And you
Well,
can't, you also can't fake for very long. You can't really lie to your doctor and then demonstrate something differently during your exam. So your history and physical is important, and your old records just basically say how reliable you are to show up for your appointments and to engage with whatever your practitioner is. And it's our responsibility, whoever your case lands in the lap of, it's your responsibility as a patient to give them everything you've got and give them time to sort it out. But it's also the doctor's responsibility not to give up on you.
Yeah.
Yes. Dr. Mark, may I just say that in the records that I was referring to, many of them were Dr. Tennant's records, and they include the history and the physical and everything you're talking about.
Exactly.
Yes.
What is even more disturbing here is that a medical record, a history, the entire medical record is something that is undesirable, that we're trying to exclude, but yet a criminal record, when we go and get a criminal record, you want everything about that client, So we sort of like flip medicine on its end, in that we're not wanting to get the whole desired information, and that may be medical, legal, or what, but that to me is just terribly disturbing to get that understanding. And thanks. Good to see you, Kristen.
Thank you, everybody.
Right.
Time for me to go.
Yeah.
God bless.
God bless.
Thank you, everybody.
Bye.
Thank you.
Thank you.
Well, you're not alone. Remember that. We'll see you again next week at the same time, same place. And look forward to seeing you next week, and hopefully see some smiling faces and hear some good stories. Hopefully hear some good news. And just remember that you are not alone. You have a whole lot of people that are right here with you. So please stay alive. Thanks so much, everyone.
Thank you.
Thank you so much.
Thank you too.